going to show you how to clean a trach on a child and change out the trach ties. So the first thing we're going to do is hand hygiene, and then we're going to put on our gloves and make sure you have all your supplies handy. So that's going to include a new trach tie. This is the trach tie, a washcloth for cleaning the neck, and then 2 med cups with water, your mild soap, and this time we're going to use sterile Q-tips instead of the regular Q-tips, okay, because it's a trach. So we're just going to take that extra precaution. So we're going to check our patient's ID band. This is Danny Johnson. We're going to tell our patient what we're going to do. Danny, I'm going to clean this little tube by your neck and change out the straps. Okay, the patient always needs to know what you're going to do. So I've got my 2 cups of water. I'm going to add 1 drop of mild soap to 1. It's rare that they order hydrogen peroxide for trach care anymore, but there will be an order. You'd have to always check your patient's order to see how they want you to clean it. And his order says mild soapy water. So the first thing I'm going to do is take my sterile Q-tip, and I feel to see which side has the cotton applicator on it, and open it from the back side. So you do not need sterile gloves, just clean gloves, and you keep these, if you don't touch them, then they will stay sterile. You put 2 Q-tips in the soapy water, and then 2 in the clean water, the regular water. And so the first thing you do is you're going to mix up that soap. And I'm going to just very gently tilt it up and out of my way. If you move that trach too much, he's going to go into a coughing spasm. And so I want to be able to visualize the skin right around that tube. And again, like you do in G-tube care, you're going to twist and twirl right up to the point of the tube. And then you can discard. And then you're going to take your other clean Q-tip and press this down just ever so gently and clean right in there, right next to the tube by twirling and rotating your Q-tip. You're going to observe that site for excoriation, skin breakdown, bleeding, drainage. Then we're going to rinse that soap off the same way. So we're going to gently, ever so gently, tilt it up and rotate the Q-tip by twisting. And then we're going to do it again on the top by rotating it and twisting. And if there's a lot of drainage, you're probably going to need several Q-tips to make that all clean. You want to leave the site exactly clean. If there's drainage and gunk right here, you'd want to take another Q-tip and clean this site as much as you can. You just want to clean it. The whole thing has to be perfectly cleaned. Okay, and then the last thing we're going to do is dry it. So you're going to take the last of your sterile Q-tips, and the same way, I'm going to dry it, and I'm going to take another one because I contaminated that one, and we're going to dry, dry, dry. Okay? Some of the sites will have a dressing placed underneath, and again, that will be an order. We put a little gauze under there if they had ordered that. So the last thing we're going to do is we have to change out the trach tie and wash his neck really well. So this is where you need a second person with a child. On an adult who's mature and can sit there and cooperate, you don't need that. They can actually hold it into place and help you. But any child, it's just unpredictable behavior, and so you really need to have a second person help you. Whether that you plan the trach care around when the mom is going to be there, or change a shift in home care so you have another adult to help you with that. Okay? So what we're going to do is we're just going to kind of turn him on his side. Take off the Velcro, and your second person is going to hold that trach down. Because all it would take is one good cough and that whole trach's going to come out, and then he's not going to be able to breathe. So we're going to unthread the tie out of the side of the trach and expose the neck. You're going to look to see if there's any skin breakdown happening on that neck. I have a prepared washcloth. I put a little soap on one corner, and we're going to just clean as much as we can and go all the way to the back. And then we're going to rinse it with the other part of the washcloth that's wet and not soapy. And then I always leave a part of my washcloth dry so I can do all in one on the same washcloth. Okay? So, we can thread that through. Then we're going to take our new trach tie, and I want to show you the ends of these ties. I have pre-cut them so they come up to a point, so just cut that on the angle. That makes it a lot easier to thread this through. So you position it on the back. Make sure that the Velcro is up. There it is. And then you can thread it right through the eyelet of the side of the trach and secure it snugly. So one side is on of the new tie, and then we still have the old tie into place. And now I get to take over holding this trach, and Kathy is going to finish the rest. So wash. And you know, the whole time you're going to be looking at the patient, how they're tolerating it. If they're going to need to have increased oxygen, that becomes a priority. You need to give him the oxygen he needs or any suctioning he needs. So she just finished doing the neck cleaning, and now she'll take off the rest of that old tie, and she's going to thread in the new one. So you want this to be snug and secure in place, but not too tight, because if it's too tight, you're going to cause skin breakdown. So the way you can tell is by putting one finger in loosely to make sure you can fit one finger under the ties loosely, or too tightly. See if you can do that, Kathy.
Up a little bit.
There, she just got one in there, nice and loosely. Okay, and that is how you do trach care.